Hi, thank you for joining me here at Dr. Nic Medicine Woman, where I hope to create a space to discuss all aspects of health and healing. I'm Dr. Nicole Hewitt. I am a doctor of chiropractic. I've also practiced functional medicine for about 20 years, and in that, I did a specialty in internal medicine and diagnosis called ADAPSI, the Diplomate of American Board of Chiropractic Internists, where we focus on Western diagnostic tools to really find the roots of health issues. And I've also studied quite a bit of Ayurveda and Eastern medicine, so I also incorporate that in whenever I am assessing what's going on with someone. My focus in practice has been laboratory diagnosis as well as energetic and emotional root causes of illness. So I want to be talking about that. And the most important thing to me is to find what is causing the problem, what's at the root, so that it can be fixed. And that root can be yanked out or fed, and that plant can become healthy again. I'm also a yoga instructor with 700 hours of yoga teacher training, 500 of which I did in India, living at an ashram. So a lot of varied experience in my education and life. And my health journey in my own body has really been what I consider my highest level of education. And in a moment, I'll discuss more about what I've been through and some of the things that I have healed and others that I've largely overcome in my own body. I've also learned a lot from my experiences living amongst different cultures and different countries and working in those different cultures around the world and learning from them and being able to practice more freely and seeing, just having a ton more experience. And lastly, I was born with some empathic healing gifts, and I have had to learn along the way to moderate them, to use them. And since I had no guidance to figure out how to use those extra senses that I was given, and I didn't even know everyone didn't have the same experience of the world for a very long time, I am now hoping to be able to share what has worked for me and how to see others. If you have any of those type of empathic gifts, and to differentiate self and other, and to stay healthy while working hands-on with people. So now I will give a medical disclaimer that though I am a doctor, I am not your doctor, and the information I present here in my channel is to be seen as friendly advice, not medical advice. And what I will be speaking to is from my own personal experience and practice and from my own health journey, and not intended to treat or diagnose any disease. If you are dealing with issues with your health, please consult a qualified healthcare provider and do not rely on the information I present or that anyone else on the internet presents. Everyone is very unique in their healthcare needs, and there is no one approach to a problem that will work for everyone. So again, I strongly encourage you to seek the advice of your qualified, trusted healthcare provider if you're in need of medical advice or are dealing with a medical issue. Okay, so now I'll go into a little bit of those things that I have experienced in my own body and kind of what got me set on this journey. Around 8 years of age, I started blacking out and dealing with weakness, fatigue, heat sensitivity, no resistance to heat and humidity. And I grew up in Southeast Texas in a tiny little old 100-year-old house with no air conditioning, a one window unit in the kitchen, but it could be well over 100 degrees and 100% humidity in the summer. And my nervous system would just crash all the time. And I was lethargic, no energy, like I say, no exercise intolerance at all. And those are things that have kind of followed me through my life. And with the blackouts, it turns out later I was diagnosed with petit mal seizures, which are called absence or absence seizures, where I would just kind of blank out and zone, especially after eating meals, and also with stressful situations. So finally, in 2009, I received a diagnosis from a cardiologist of dysautonomia. And that began my journey of learning how to regulate my nervous system. So, like I say, my entire childhood and young adulthood, that all of these automatic functions in my body, which are 95% of body functions, are controlled by the autonomic nervous system. Like I say, it's just a fancy way of saying the automatic nervous system. Sometimes that system will get glitches in me, and it's like a pause button is hit, and I might have to breathe voluntarily, or TMI, I went 4 months without a bowel movement one time. Yeah, and I was losing weight. So yeah, it can be very tricky to figure out why things aren't working so well. Some other things that have complicated things in my body is I was born with spina bifida occulta, which is the pokey points, the spinuses on the vertebrae, the feeling, what you can feel when you touch the spine. In my lower spine, I had 3 levels where the spinuses didn't form, so that can create extra pain in my low back and just some complications there, as well as a type of neurological tumor at the top of where the spinal cord develops in utero whenever a baby's developing. And I had a dentist tell me one time that tumor that I have here, it actually holds my 2 front teeth in, so not to have it removed. Other things that I've dealt with are intestinal parasites, really, really severe intestinal parasites. I first contracted while living in Ecuador in 2002, 2003, developed ulcerative colitis, so bad that at one point I only had blood and no stool. Let's see, I've also dealt with traumatic injuries, starting with a diving accident at 12 years of age, where I ended up hitting my neck on the board, and chiropractor saved my life. And that's actually how I initially got into the chiropractic profession eventually. And I also had some bad falls downstairs that left me with bouts of disability and intensive pain throughout my life. And in 2016, I contracted malaria while living in the Amazon jungle in an indigenous Achuar community. One mosquito bit me, and that mosquito reset the course of my life thereafter, because the complications of the malaria exacerbated the nervous system symptoms that I've had, and to this day I still have sometimes recurring bouts of malaria from time to time, but with much less frequency than the first 3 years after that. So those are the highlights of the most significant struggles I've dealt with in my health. And my goal here is to share my healing journey and to hopefully inspire you to find hope in your own healing, and to know that healing is possible for everyone. I've tried so many therapies and healing modalities, and quite honestly, very little that I've tried has helped. And so I'll be sharing with you what has helped, and I'll be sharing what I've learned along the way and from my experience in my body, which has taught me a ton and helped me to understand other people and to help patients across the years. Also, I'll be sharing what I've learned in clinical practice working with people in many different cultural settings in multiple countries, including some ancestral healing traditions. Common ailments that I've helped people to resolve or stabilize through my 23 years of practice include, but of course are not limited to, parasite issues, thyroid issues, which I've seen quite a bit of because it's quite underdiagnosed, gut and digestive issues, which are usually related to everything, and autoimmune disease, which is directly related to gut digestive issues. A lot of liver issues, especially related to thyroid disorders, tons of gallbladder problems. Even if someone has had a gallbladder removed, there are still things that can be done. Things like diabetes, cellulitis, and all types of infections. So my goal here is to hopefully help you to find hope that healing is possible, as I said, and to inspire you to begin listening to your own body cues. This is so important. Learning to recognize when your body is telling you what it needs. So when we finally learn how to listen to those messages, the journey becomes a lot easier because we can be like, oh, I have this pain, and maybe that is cueing to me XYZ, that's what it's trying to tell me. So I want to mention and stress also that there is a definite mind-body connection when it comes to health, and I'll be delving into this as well. And from my experience, I do believe at this point that it's practically impossible to heal from any physical and or mental ailment without addressing the related underlying emotional, spiritual, intellectual roots of those symptoms. So we will be discussing that. And of course, the foods we put into our bodies also play a critical role. So we'll be addressing this aspect of health as well. So if there is anything I have mentioned here that's of particular interest to you, please let me know in the comments below, and I will focus on sharing information on that topic. Thank you for joining me on this journey where I hope we can continually learn from one another and learn to heal together.